Hello, I am Dr. N.S.Prajapati. I am from Bombay, one of the senior psychiatrists. Studied from KM Hospital, San Hospital, Nair Hospital, GS Medical College, Topiwala Nair Medical College, and Lokman Tilak Medical College. I am practicing as a psychiatrist since many years, more than 20 years in Bombay. Same time, I am attached to many hospitals as a teaching staff. Now at present I have joined this hospital, KMC Medical College and KMC Hospital, as a professor and HOD in psychiatry department. Now the staff of this hospital, KMC Medical College, they want me to talk to on topic depression. So depression is one of the major disease, is a very common morbidity in psychiatry, and globally it is all over the world. It is increasing day by day because of psychosocial stressors. The causes are now proved that they are biopsychosocials. Various neurohormones are responsible for depression, and depression is also various terminologies there: major depressive disorders, dysthymic disorders, or affective disorders. So many terminologies there, and usually in India we follow the American Psychiatric Association's terminology as well as ICD classifications. Now the depression is increasing day by day because various factors like migration, industrialization, urbanization, competition, ambition, struggle is increasing day by day in all types of populations. Even in farmers, you must have heard the suicides are occurring. Even in females, suicide is more, attempt is more, and commitment is less. But suicide commitment is more in male than the females. Successful suicide is more in male people, because they have more decisive power and more strong mental effort to kill themselves. So that's why the depression is one of the cause. And in depression usually we get the early symptoms like cognitive symptoms, affective systems, affective complaints, and behavioral complaints, emotional complaints. Early phase, they say that they are having hopeless ideas, helpless ideas, worthless ideas, sad ideas, low self-esteem, pessimistic ideas, negative ideas. Besides that, they have various emotional and psychological problems like decreased sleep, decreased appetite, irritability, anger, poor interpersonal relationship, even suicidal thoughts, as I said, then the poor concentration, poor attention, so very memory problems, and lack of energy, lack of interest in work activities. So now these are the gross symptoms, so that as a psychiatrist we find out that they are suffering from depression, and then they require urgent like detection and then the treatment. Then various types of depression is also there, as I said: endogenous depression, exogenous depression, minor depression, then akinetic depression, retarded depression, agitated depression, sometimes psychotic depression. If the depressed patient is having some hallucination, delusion like, which is the psychiatric typical symptoms, if they are present, then the patient is said to be suffering from psychotic depression. Then we treat accordingly. We add antipsychotics also. Mostly the depressed patients are treated by counseling, by psychotherapy, by behavior therapy. Besides that, psychopharmacological treatment, they are called antidepressant. Same times we add anxiolytic treatment also, hypnotic for sleep, and antipsychotic once they are having hallucination delusions. Even these drug addict patients, mostly alcoholic, brown sugar, charas, ganja, bhang, these addict patients are also having the depression. Even childhood depression is very common nowadays in school children. Because of separation anxiety, they develop gradually the pain in abdomen, headache, etc. They are also equivalent to depression. So depression has various spectrum type of symptomatology, so, and which is very common in our country nowadays in India. So I hope that in our college, KMC College, as well as KMC hospitals, we are getting a lot of patients of neurotic depression patients. So we'll treat them and we'll make them well. So mental health is very important. So that's why we have to treat the depression in early phase, so that the consequences and complications of depression should not occur, like marital disharmony, family psychopathology, suicides, homicides, or running away from home. So these consequences equally should not occur. Before that only we should treat them. So we should not take lightly this depressive illness. It is very, very hazardous, very, very dangerous also, because a lot of impairment of social function, family functions, even the impairment over the jobs. They are depressed, say they avoid the working job, they don't have energy to work, they don't have liking to the job, and then run away from the job. So the productivity of the whole nation and the productivity of the community and the area wise or district wise, it decreases. So as a psychiatrist, we treat them and we make them normal to the society again. So I think every individual has right to get treated for his or her mental health. So depression is one of the common illness. That's why I just had talked with my colleague for depression. But there are so many other mental problems nowadays: anxiety, phobia. Now NEET exam, result is there. A lot of chaos going on. So they also create problem in the NEET students. So PG NEET also. So all the competition, ambition, all these things, they lead to depression, suicides. So I think that this requires a lot of attention from the professionals, mental health professional, as well as government professionals, health professionals, government, semi-government, Nagar Nigam, as well as government of India, state government, UP government. I think all these professionals and leaders, the government peoples and paramedical, medical people, they require the attention to detect the mental health and treat them very well. The depression is one of them.